This video we will learn about counseling processes. So in yesterday's video you have already know how to assess a personality, how to assess a person. After assessing a person we are done with the diagnosis. So what we do after diagnosis? We start the counseling process. So this video contain everything which is required to start with basics of counseling process. So let's not waste the time and hop into your computer screen. Okay, so let's start with our today's topic, which is counseling process. We'll start with counseling definition. So, definition of counseling. It is given by Roger. The process by which the structure of the self is relaxed in the safety of client relationship with the therapist, and previously desired experience are perceived and then integrated into an altered self. So self means the client which is coming to us for counseling, which is coming to the counselor for the counseling. Okay, so in the counseling is a process where that self is relaxed in the safety of what type of safety. We provide a safe environment where the person is coming with the person who is coming for counseling is so vulnerable. So he is coming with a vulnerable self, and he feels so safe in that relationship that the all the previous desired things she had or he had in his life are perceived and are integrated into an altered self. The self he discovered while counseling, the self he diagnosed and treated and is now cured in the counseling, and all the desired he have is now integrated. First they are perceived and then now integrated in the altered self. So this is counseling do. Counseling, what counseling do is counseling cure the self. The self is so vulnerable and so exposed to all the problematic behavior and problematic situation. Now the self is cured and now he has a good perception and can be the desire he have is not troubling him. He is now integrated in it and now helping him to grow. So nature of counseling, it is both process and a relationship. We always say counseling is a therapeutic relationship because like any other relationship, it start with icebreakers, it start with humor, it start with rapport building, and it end with the termination of therapeutic relationship where because the relationship, it is counseling is a relationship somewhere people develop transference for their psychologists, and psychologists also develop counter transference. Transference is when a person started feeling good and feeling toward the psychologist. He assumed that psychologist is his lover or his brother, his sister, his friend, whatever he can assume. So that transference should not be there. Okay, the transference. So for that thing, we terminate the therapeutic relationship. So it is a process and a relationship. As a process, it is a process by which attention is given by both counselor and counselee to the problem and concern of the student is in setting of privacy, warmth, mutual acceptance, and confidentiality. First, we are discussing a problem. We are discussing and we are curing a problem. We are there to cure a problem. So there is mutual acceptance should be there, confidentiality should be there, warmth should be there. So it is a process. It happened through a process. Rapport building is there, sharing is there, caring is there, everything is there. So it is a process. As a process, it utilizes appropriate tools and procedure which contribute to the experience. The skills counselor have is also tools. The tools we actually use, assessment tools are there. Procedure is there. A counselor should follow a procedure. If he is using any type of counseling technique, he should follow the complete technical procedure of that counseling thing. And as a relationship, it is categorized by trust, confidence, and intimacy. It is intimacy. Why? Because it is just two people discussing everything in this life. So this is kind of intimacy is there, in which a person gains intellectual and emotional stability from which he can resolve difficulties, make plans, and realize greater self-fulfillment. Okay, so now you understand what kind of relationship it is. It is a great kind of relationship. It is not a toxic relationship we are having these days. Okay, so being in a toxic relationship is not good, but being in a counseling relationship, in a therapeutic relationship, is great for yourself. It will make you a great person. It will make you a managed person. It will make you a sorted person. It will make you a calm person. So nature of counseling is like this only. Now, Ford and Urban is cited four nature of counseling. First, counseling involves two people in interaction, a generic term for the exchange of meaning between two people, which include the direct communication of talking and listening, as well as gesture, glances, nods, and shakes of heads, frowns, and non-verbal feature by which meaning is transmitted from one person to another. The interaction is highly confidential, and since counselors discuss themselves in an intimate fashion, it is highly private and unobserved by other. Okay, so it is what it is. Their nature. They say first it is involves two person in an interaction. It is interaction between two person, which is intimate and which should be confidential. Confidentiality you will see everywhere in counseling. Everywhere there should be confidentiality should be there. Okay, because a person is sharing what private problems, you cannot share it with anyone. You, because it will create that person. That person will react in certain way. Okay, it can react in any way, so you should be really and it is not an ethical process as well, so you should be confidential about your counseling process. Second, the mode of interaction is usually limited for verbal realm. The counselor and counselee talk with one another. Counselors talk about themselves, their thought, feeling, and action. They describe events. The counselor listen and responds in some fashion to what the counselor say to provoke further responses. The two think, talk, and share their ideas. So, second thing, mode of interaction is usually limited to verbal realm, where the person who want to take counseling, जो counselee जो there is there, counselee take counseling, okay, and he share every story, every situation, every trauma she or he had, and you have to respond in certain way to gain more and more from that. You have to react in certain way that he share more and more with you. If he become reluctant, the counseling process will stuck. So this is the second nature. The second thing about the nature, the interaction is relatively prolonged since alteration of behavior take time. In contrast to brief of conversation with friend in which distortion and unconscious desire are usually maintained and usually one only temporary relief is gained, counseling has its goals, the change of behavior. It is assumed that through the counseling interaction, the counselee will in time revise and distort his distortion and alter his behavior. So why are we doing a counseling? We should attain a goal. We should change the behavior. We should enrich the quality of thought that person is having. We should alter his behavior. We should manage his mood, behavior, everything. Okay, so nature of counseling should be interaction relatively prolonged since alteration of behavior takes time. It should be prolonged. It is nature of counseling. It is slow and it is prolonged. Why? Because we have to alter a behavior, we have to manage a mood, we have to manage a behavior, we have to develop a nice behavior and then maintain it. So it is a long process. The purpose of relationship is change of behavior of the counselor. The counselor focuses the interaction upon the counselor. Counselor need not to be concerned about the happiness of the counselor, must devote their energies to change themselves. A lot of time when I am practicing counseling, a lot of people say that you are worst person, you are not good for me, you are not doing good for me, you are giving me more headache, you are giving me more things. So they talk, but they should not care about me. They should not care about their counselor. Okay, they can be any way they want to be in front of me, because it will help me to assess that person better. Okay, it will help the counselor to assess the person better. So a counselor should provide an environment where the person, if he want to abuse, he can abuse. If you restrict his behavior, you won't assess his behavior, you won't able to reach the problem out and solve the problem also. So these are the nature of counseling. Now we most of the time we provide guidance to the person, and we misinterpret it as counseling. So guidance and counseling are two different things. First, guidance refers to an advice or a relevant piece of information provided by superior to resolve a problem or overcome from difficulty. You are new in your company, and your senior member or your brother who is also working in that company provide you some information to solve the problem associated with your workload or your mental health. That is guidance. That is not counseling. They haven't assessed your personality. They haven't done any. They haven't. They already have your repo build. A lot of things are there. So there is guidance. Counseling refer to a professional advice given by a counselor to an individual to help in overcoming the personal and psychological problems. Okay, so we can say to guidance is somewhere a practical solution. Okay, practical solution, or it is a solution to change the situation. But counseling is not there to change the situation. It is to change the reaction toward the situation. Okay, so this can be a good difference between guidance and counseling. So guidance, we like more about the difference between guidance counseling is guidance is preventive. It prevent to be behavior to not happen. It is, and if we say about counseling, it is curative. It cure a behavior. It should not prevent a behavior. Okay, it should not prevent the anger. It should manage the anger. It should cure the anger. Okay, and guidance, if you are feeling this way, na, don't do this thing, don't do this thing, don't do tell people like this, don't abuse, don't do. It is preventive. It is not a curative. Help individual to make the best choices. Guidance help individual to make best choices. What counseling do? Counseling help individual to change their perspective. Change the perspective that is it required? Is it like the mental trauma you are feeling, the mental stress you are having right now? Is it so much required? Or if we change the situation, will be everything will be get cured? You will still require some help. You will still require some things. Okay, uses an in if we say about guidance, it uses an external approach to tackle the issue at hand. Okay, it changes the situation. But counseling, it in-depth approach to establish the root cause of the problem. It establish the root cause of problem. It solve the root cause of problem. The problem is with the perception. Okay, the problem is with the intellect. The problem is with the irrational belief. The problem is not with the situation. Because how much you will prevent a situation? You cannot prevent a situation for lifetime. Some situations are inevitable. So a person should be treated in depth, not the situationally cured. The person should be cured in depth. Preventive, okay, if we say about guidance, so does not require professional training, but counseling have a great process to gain license to be a counselor. And if we say about guidance, provide a ready answer and decision for client. They provide a ready answer. Do this thing and this will happen. Do this thing and this thing will happen. But in counseling, there is they empower individual to create most appropriate solution to tackle an issue. Okay, they provide scope for creativity. They provide scope to use their cognitive skills at best. Why? Because if another situation will come, that person can handle himself. Okay. Why? Because there will be a termination of therapeutic relationship. We are not going to be there in his life for lifetime. Okay, we are not his parents, we are not his brother, we are not his daughter, we are not his wife, we are nothing. So we are not going to be get in his in life for time. So we have to just empower that individual so he can take decision on his own, and he can handle the problem on his own. Now we also like confuse the counseling process with psychotherapy also. Counseling is a short-term process, but psychotherapy is a long-term process. Okay, there is a procedure attached to psychotherapy which we have to follow. In some psychotherapy there is not procedure, but still counseling and psychotherapy, if we compare, so comparatively counseling is a short-term procedure. It can be end in 4 or 5 counseling sittings, but psychotherapy can take many years or many months too. Counseling deal with the present issue that are easily resolved on the conscious level. A person is talking about that issue. He know that this kind of issue I have. Please solve this problem. Counseling help with this. But psychodynamic, if we are saving psychotherapy, is psychodynamically approaching the person. He is treating the person, his psychological history, he is examining everything and now treating the person. If we talk about counseling deals with immediate cause and stress and anxiety, helps to enhance interpersonal and communication skills. It develop a person's skills. It develop a person's cognitive and intellectual skills. But if we talk about psychotherapy, it is an evolutionary process that help a person to uncover root cause of problem. Okay, the person can uncover the root cause of problem. He can understand, if we say like if person is there for anger issues, a counselor will help him, provide him anger management techniques, anger issues. He listen to his anger issues. He check his anger issues and provide him stuff and provide him stuff to understand the situation and do not feel anger and how to react in an explosive situation. But if we talk about psychotherapy, if we consider RABT, rational emotive behavior therapy, so in that therapy the counselor will identify that person's irrational belief attached to the aggression, attached to the situation he had, and then cure that person in some way by doing what? By like disputing his irrational belief. So it is a wholesome cure of the problem. Okay, it is not just for the situational problems, but it cure the person internally. Counseling is okay. Counseling is a great process, but psychotherapy is more deeper. Some way it is in more depth. So goals of counseling. What are the goals of counseling? First goals is to help the counselee become self-actualized. The person who is taking counseling should develop insight and should realize who he is, actualize what he is, what is the situation, should know and understand what is reality, should be in touch with reality. Second is to help the counselor to attain self-realization, the same thing, where he realize what he is, he realize what is his economical and mental status, and do work accordingly. Third is to become fully function person. Okay, to become a fully function person, it is required, counseling is required. The fourth, achievement of positive mental health. A positive mental health should be there. This is the goal of counseling. Fifth, if there is any problem, resolution of problem should be there. Next, improving personal effectiveness. The person is effective in a lot of things, but personal effectiveness should be there. A person should be effective to deal with a lot of things. Okay, so improving personal effectiveness is also goal of counseling. To help change, we can say to understand the change, to observe the change, to feel gratitude about the change. These are goals attached with change in counseling. To help in decision making, the person should make decision good. Okay, after counseling, if the person is not able to take decision and is still calling and calling and calling you again, then the counseling is not, you haven't done your job well. The person should be a good decision maker at the end of counseling, at the termination of counseling process. Okay, and also if there is any if we say any faulty behavior is there, so behavior modification should be there. It should be our goal. So goal could be according to the situation and according to the counseling. We can set our goals of counseling, and we try to reach the goals in a set period of time which we have mutually decided. What are the misconception about counseling? Misconception about, there are a hell lot of misconception about counseling. Counseling is only for people who have serious emotional and mental problem. People which are having a lot of mental problem should take counseling. If you are going to take, I want counseling, if you're mental or what is wrong with you? You are okay, you are not having any anger issues, it was an explosive situation. So this is kind of misconception is there about counseling. Counseling is only for people who are too weak to overcome an addiction or some other type of inadequacy in a deal with problem on their own. Similar kind of thing. The counselor will teach you how to cope with your problem. We do not teach you how to cope with your problem. We just advise you, not even advise you, but improve the effectiveness of your decision making. Improve the effectiveness of your thought process. This is what a counselor do. A good counselor will provide you with a quick solution of your problem with little and no effort on your part if you ask them. No, we cannot. We know it is a long process. We know it is a slow process. So we cannot provide you as a solution just that quick. When in counseling, the counselor does not most of the time talking and you listen. No, it depend on the situation. It depend on the issue. Somewhere when we are rapport building, we talk more. Sometimes we talk a lot. Sometimes we do not talk at all. We listen to the person a lot, because it depend on the situation and the problem we are dealing with. If the problem is there and the person is sharing, if the person is reluctant, obviously the counselor will break ice by sharing any story, by doing some humorous thing. Or if the person is not sharing, is still reluctant while being in the counseling process, where he shared the problem but is not sharing a lot, so the counselor shared his life, that I was like this, I used to do this and all the things, to break the reluctance. So the number or the part of talking is not set in counseling. We cannot decide that who will talk and who will listen. It is eventually it happened. Okay, by in the counseling process is happened. Counselor will work towards changing your belief and values to confirm to right way to feel and act. No, we do not act to like deal with your values or something, but just we just provide you a way to think critically, where you yourself decide what to do and what not to do. Is you yourself check your belief are rational or irrational. Okay, if you choose to seek professional help, you are considered mentally unhealthy. No, you are not mentally unhealthy. You are a good decision maker if you are coming to counseling. Counseling is painful, unpleasant, and serious. It is. No, counseling is not painful. Sometimes you might feel pain while sharing your stuff, but at the termination of relationship of the counseling, you will feel sad that you are leaving that counseling. Somewhere, if you are develop any transference, but somewhere you will feel light-hearted, light-minded after the counseling. Can it really be confidential? Yes, it is confidential. A counselor should be ethically confidential. He cannot break the rule of confidentiality clause. So these are the misconception about counseling, and there is nothing like this which we have heard from people. So understand the counseling process. There are n number of stages in counseling process. First is identify the need for counseling. It is done by the counselor only. You identify that for this behavior or for this situation or for dealing with this stuff, I should take counseling. Prepare for counseling. Prepare yourself for counseling. Prepare yourself for sharing stuff. Prepare yourself for presenting. And at the same time, counselor prepare himself to break the reluctancy of the counseling. Now third is counseling, where we conduct the counseling process. Okay, where the counseling is actually happening, where is the complete procedure of counseling happened. Then there are follow-up. There are follow-up where what we check on regular basis, on weekly or monthly or yearly basis. We check how you are feeling, how good you are doing. Okay, so these are follow-up. This is the only after the termination of therapeutic relationship we do what we do follow-ups. Other way around, initial disclosure is there. First thing, okay, if we see on another level, initial disclosure is there. First you disclose. Counselor also disclose his life. In-depth exploration is there, where we explore where the problem is actually residing, where they're residing in the person's life. Commitment to actions. We have to commit for the actions. You know? Counseling interventions are there. We develop intervention plans where we know what type of treatment will provide, what type of counseling will provide, what type of talking will be there. Okay, so counseling interventions are there. Evaluation and termination and referrals are there. Okay, so evaluation of the persons after counseling process. We in psychological assessment we see that we psychological assess person after counseling process too, and terminate the session and referrals are there. So these are all things related to a counseling procedure. Now procedure in counseling: establish safe and trusting environment. First we have to do is we have to establish a safe and trusting environment where the person can share. Why? Because in first thing we said ki prepare for counseling. Okay, initial disclosure should be there. So person will feel safe and feel trustful, then he will share only. Help the person put their concern into word. Help them, provide them with words like, are you want to say this thing? Are you comfortable saying this thing? Okay, I understand. What more? Okay, so like we have to promote the talking from side of counseling. Active listening should be there. You cannot ask the person, sorry, what? No. Why? Because you are not he is sharing what? He is sharing feelings, he is sharing emotion. If you tell him to tell you again, or if you tell him to like recite the whole story again, he will not. And if he will like keep something to him also. Okay, himself, he will keep something to himself. Like I want in the first thing he shared, and then he won't share. Transfer problem statement into goal statement. Whatever the problem the person tell you, whatever the problems the person say that I have this problem with anger issues, your goal should be anger management. I have stress, you should be stress free is your goal. Okay, so this is how we explore possible approaches, and also we explore possible approaches to goal. There are n number of approaches to reach the goal. We have to decide our approach and then reach the goal. Help the person to choose one way toward the goal. Whatever one way, like We decide, we communicate the issue, we understand the issue, then we provide a way that this is the person who want to reach there, you are that person and you have to go this way. So we sometimes we help the person to choose one way, where should he go, what should he do, how should he do, we help them to do this. Make a contract to fulfill the plan. Make a contract to fulfill a plan, where in that contract we also see what the confidentiality will be there. Okay, will reach this type of intervention should be there, assessment should be there, all the things should be there. Summarize what has occurred, clarify and get verification. Whatever the story that person had, summarize it. Okay, paraphrase it. Are you talking about this thing, what has occurred, everything you said to that person, that are you saying this things, clarify that person and then get verification. If she's not back, I'm saying this, then you are on a right track. After doing everything, after telling you, ask for feedback and confirmation. Might possible if you the person is just nodding hand, why? Because he's not actively listening. But if you ask for feedback and confirmation, it will be we can understand that that person is actively listening to you or not. So first we have to active listen, and then to check the active listening, we get the feedback and confirmation from the counseling too. Okay, so that's up for our counseling process. In next video we'll study what is REBT. That's all for today's session, guys. We'll meet in the next video.